So far in Henderson County Emergency Services series, we've taken you behind the scenes with an in-depth look at all the training our paramedics do to prepare for their work. And we went on a ride-along with paramedics Tyler Upton and Mike Cochran. And as we spent that day together, they really opened up and shared with me how important it is to cope with the events they see.
You know, our day-to-day, we may see in 3 hours what other people might only see in a 60-year lifetime. And we have to process that somehow.
With what our staff deals with on a daily basis, it's really important to have a variety of tools in their toolbox to deal with the mental health challenges that they face. That starts with like our peer support team that's done with peers, you know, the folks that they work alongside every single day. They can talk to them and kind of unpack of some of the things they've seen, and that escalates up from there to some other tools we have, like our trained mental health counselors that are embedded in the wellness clinic.
Do we want them to do the advanced training?
Wellness Director Dr. Jamie Gibbs and her staff are on the front lines with the county's public safety officers. From training and counseling to performing ride-alongs, the wellness team is there to offer full support.
We have worked with DSS, we have worked with the Sheriff's Department and EMS for them each to have their own peer support team, because you're going to tell a peer quicker than you would an outside person. And of course, we're always the backup for the peer support team, that if they are trying to help a peer and they have questions, they can call us, tag us in, which has happened multiple times of like, hey, this is where the conversation's going, tell me what I can do, what I can say. All we're trying to do is have that ground level of prevention so that people know that they can talk about it, that suck it up culture that I was raised in healthcare with, and I know they were raised in emergency services with. We're trying to get well past that, but there still is some of that ingrained of you're going to be fine, and we're doing a better job. I really think we have a long way to go, but we certainly have made a lot of ground just by starting with peer support.
Keeping these men and women, keeping them to where they're able to perform at the top level, to keep up with the demands, and also where they're able to enjoy life outside of the job, to unload some of these stresses, that is so important.
The driving factors for these peer support groups and embedded mental health counselors came from a series of events that happened to our EMS team several years ago. Steve Wyatt was a county manager during this time, and he helped lead the effort to start this program.
You don't solve a problem by looking the other way. And I hope that one of the things, if I had a legacy other than being tight with the people's money, was that we didn't look away. We tried to address things. Now, we weren't always successful, but we didn't sweep things under the rug. We tried to address things. In this case, it's obvious to anyone that's paying attention the issue that's out there among public service, emergency services, law enforcement, child support, child abuse investigators, those folks. Folks that are dealing with, again, the things that you and I wouldn't even want to look at, and the average citizen doesn't want to look at, okay? But we're asking those people to enter the breach. And so I feel like we've addressed that. We've addressed it head on. It's a model program across the country. We've gotten calls and from people interested in it.
You know, we're giving them that foundation with training, but now we've also got a system in place. After the calls are over, we've got trained people, we've sent people to training, we have a really good peer support team. There's certain calls that automatically trigger us to reach out to our fellow paramedics, talk to them, and people across the state were blown away about what we're doing here and what our commissioners and Jimmy and Mike and everybody helped us get as far as embedded mental health clinicians who work with us, because inevitably this stuff piles up. It's cumulative the longer you stay in this job.
I sit on the Training and Standards Commission in North Carolina, and we're actually discussing how to make something like this mandatory across the state. So it just shows what Henderson County's done, how proactive that's been.
Our emergency services teams train extremely hard. They are ready when the call comes in. And in Henderson County, we have support systems in place to help them cope and deal with the emotional and mental aspects of the job. And they all deserve our full support and praises for the services they provide.